Hello, my name is Carl Johnson with HIPAA Certify, and today I would like to talk to you about how to become HIPAA certified. If you work with patient information or are in the healthcare industry, this information applies to you. First, let's talk about HIPAA. What exactly is HIPAA? Well, HIPAA stands for Health Insurance Portability and Accountability Act, which basically states that you must use concern when you are handling patient information. Additionally, you must always protect patient information. Now, HHS does not have its own standard certification program. So in order for you to become certified, you must go to a third-party assessor like HIPAA Certify. Some of the major benefits of becoming HIPAA certified is most importantly protecting patient information. To me, that's number one. The other benefits are, of course, building trust with your patients and also making sure you build trust with your partners. By not protecting patient information, of course, there are some penalties, and we'll discuss that as we go along as well. So if we were to break down HIPAA, the most key importance is one is the privacy rule, which basically makes sure that the disclosure of patient information is need to know only and that it is always protected. The second part is protecting the information. How are you going to protect it? Third part is notification of a breach. You have 60 days to notify HHS if there has been a breach. Now, for entities that cover HIPAA, there are mainly your four entities, which is your healthcare providers, health plan companies and organizations, healthcare clearinghouses, and business associates. Let's talk about what each of these mean. So for healthcare providers, that is your doctor's office, your dentist's office, anyone that is working directly with patients and that you are storing patient information. For health plans, that could be your insurance companies. In this example, I use Blue Cross and Blue Shield. Your healthcare clearinghouses, well, it could be a payment service processor, or anyone that is coming interact with the patient data and maybe transmitting it. Well, that will also fall under HIPAA. And lastly is your business associates, such as an IT company. If an IT company is storing patient data or interacting with patient data, then they also would fall under HIPAA. So if we were to do a high-level breakdown on what are the steps to become HIPAA certified, well, first you have conducting a risk assessment. Then you have implement necessary safeguards, develop and implement policies and procedures, train employees, monitor compliance, and conduct regular audits. Let's discuss what each one of these mean. So for one, conducting a risk assessment. The risk assessment is just to show gaps and where exactly you need improvement within the organization. So within your risk assessment, you're really evaluating your existing security and how you maintain your security, and also give you a good idea of what needs to be resolved or fixed or remediated. Second up is, of course, implement the necessary safeguards. Now that we know where our gaps are, now we can start the implementation of safeguards. First and foremost is developing your policies and procedures, basically your SOPs. Your employees have to know what exactly they need to do when they encounter any patient information. What are the steps? What are the processes? This needs to be documented and this needs to be signed off by your employees. The second part is the physical safeguards, right? Protecting information, but at a physical level. One example that I see time and time again is leaving patient records information on the counter, right? Employee goes away to lunch, they forget to put all the patient information into a filing cabinet. That would be a direct violation for HIPAA compliance, right? So training your employees what to do with patient information is a big deal and needs to most definitely be constantly preached and trained into your employees. The third part is the technical safeguards, right? The security of your computer systems. Are your computer systems locked? Do you have ACLs, which just basically means who can actually access information? Only those that need to access information. And then the fourth is when you are transmitting PHI, is there encryption involved, right? Is there auditing involved? Do you know who transmitted what time, what date, who it went to, who opened those documents, who viewed those documents? Links that you have sent out last year, have they expired, right? Or can someone still get access to those links that you sent last year sometime, right? Having expiration on those links. Additionally, with cloud service, who is your cloud service provider? Are they also HIPAA compliant, which all cloud service providers are not? Next up is developing and implement your policies and procedures. And as mentioned, this is to me is the most important part, because if your organization does not have policies and procedures and SOPs in place, it's very hard to teach and guide employees into doing the right thing when they are handling PHI. That starts with your standard SOPs, right? Standard operating procedures. So making sure that you have those in place and that all employees have signed off on them is the first part of being HIPAA compliant and starting towards your HIPAA certification. Training employees. I can't say this enough. Training doesn't just start when the employee is onboarded, but the training must continue throughout their whole entire life cycle working with your organization. Whether we're talking about quarterly training, monthly training, all employees must be trained, and they must sign off on the training to make sure that they comprehend. Oftentimes, especially when we talk about compliance training, it becomes numb to the employees. They've seen it time and time again. Even HIPAA, everyone at some point has taken some type of HIPAA training. So it's important to keep the training fresh, make sure the employees are doing assessments, and don't assume that just because employees have worked in the healthcare industry for many years, that they actually understand every part of HIPAA. Monitoring compliance over time is the best way to understand where you need to make changes later. So with compliance, it's not necessarily a set it and forget it. As employees are using systems, as information is changing, as systems are changing and software is changing, you need to constantly monitor the compliance. This is involved with your policies and procedures as well, making sure that you update your policies and procedures based on the change of work, change of roles that each employees are doing. Additionally, when it comes to monitoring compliance, there are tools that you can use as an organization that provides alerts and making sure that you are reporting on any changes that happen in your system that may affect your compliance and your security posture. If you have any questions about this, HIPAA Certify, we have many tools that we can recommend to you to help you with this. Conducting regular audits. Audits, the word audit is sometimes considered as a negative or a bad thing, but audits, just like an assessment, is good because it allows you to know exactly where you stand and where you need to improve. Your audits also let you see any gaps that you may have missed from the last time you've had an assessment or an audit. It's best to have a third party to do your audits, not just do internal audits. And the reason being is sometimes because of biasness and also making sure that there is proper reporting. For a HIPAA certification process, the first part is finding a partner that's going to help you with your certification. There are organizations like HITRUST and HIPAA Certify that can help you. Once you've established that, the next part is making sure that you provide all of the documentation that you currently have for your organization regarding HIPAA and PHI. This helps as evidence, and so we can see exactly what you currently have. And as our auditors come on site and start to review your information, we're going to use what you have submitted first as a guideline of where we need to first start doing your audit. The next part is preparing for the certification audit. And this just means that you have updated all your policies and procedures to the best of your ability and that you're basically ready for your audit. Now, audits, just like any certification or compliance, is not a one-time. You should most definitely look at your organization as a whole and when you should do your audits. If you have a smaller organization, you may not need to do audits that often. If you have a large organization with many vendors, lots of supply chain, lots of systems, remote employees even, different vendors, cloud solution environments, that can get pretty complex over time. And it's best to schedule your audits, whether it's monthly or quarterly, but don't wait an entire year to conduct your next audit. Some of the challenges that comes up when we're talking about audits, the biggest challenge is, of course, staff. Right? Not all organizations have a staff of compliance teams, security teams to help along the way. So if you ever get stuck or need that additional help, of course, HIPAA Certify is here to help you with that. The next part is making sure that everyone is trained, right? Like I mentioned earlier, do not assume just because someone has worked in the healthcare industry that means that they are properly trained for HIPAA. Make sure that there are regular trainings and make sure that there are different types of trainings that are not just the standard training that you normally see where you click through and then you do an assessment at the end. Make it fun, make it entertaining, make sure that the employees understand and comprehend exactly what they are receiving from the training. And as mentioned, the biggest benefit of being HIPAA certified is that now to anyone else, they view your company as someone that they can trust, right? Most importantly, make sure that your patient's information is always protected. Even one patient's information is breached, that's one too many. So making sure that you are always heading towards HIPAA certification, keeping your systems HIPAA compliant, make sure that you are always in a good place. Some resources and tools for you. Of course, HHS website has tons of great information and they keep it updated. Of course, many years ago, I wrote a book on HIPAA Privacy and Security Compliance, which is also good for someone that is brand new to HIPAA privacy and security. There is also tools that I can recommend, and I'll put some links in the bottom. Additionally, if you have any questions about HIPAA compliance or HIPAA certification, HIPAA Certify, we're here to help you as well. And if you need any assistance with auditing, we are here to help with that as well. So, in a conclusion, one is making sure you conduct a risk assessment of your own organization, where exactly you stand, understanding who are your vendors, your supply chain, your cloud solution environments, and just making sure that all the systems that you are using are HIPAA compliant. Implement the necessary safeguards, right? Put safeguards in place to protect your organization. Most importantly, develop your policies and procedures, train your employees, and remember that compliance is not a one-time set it and forget it. constantly monitor compliance, and regularly do audits. Don't wait an entire year to do an audit. It's best to either do audits monthly or quarterly, depending on the size of the organization, but do not wait an entire year to do your next audit. And with that, I hope you have learned something from our how to become HIPAA certified. If you have any questions, please visit our website at HIPAAcertify.com. Thank you and have a great day.